Hello everyone, welcome to our educational channel. My name is Zetu. I am here today because I would like us to talk about the condition tonsillitis. Tonsillitis is a common childhood condition, although it does affect teenagers and it can also affect adults. What is tonsillitis? Tonsillitis is the inflammation of the tonsils. The tonsils are two small oval-shaped soft tissue masses that are located on either side at the back of the throat. What is the function of tonsils? Tonsils help the body to fight infection since tonsils are part of the immune system. Tonsils contain white blood cells that are responsible for killing the germs. Tonsils flushes and filter the bacteria and viruses that enter the body through the mouth and through the nose. Since the tonsils are exposed into infection, even tonsils themselves can become overwhelmed and they become infected, and the condition is called tonsillitis. What are the causes of tonsillitis? Is the viral infection, and another cause is bacterial infection. What are the signs and symptoms of somebody who's having tonsillitis? Is the sore throat. The throat can be so sore that individual is having even difficult to swallow. Headache. The pain in the ear or ear pain. Fever, chills with high temperature. Bad breath, which is halitosis. The tonsils becomes red and swollen. In small children, the signs and symptoms can also cause the stomach pain, and the vomiting can also follow. Especially to the younger children, they lose their appetite and they become very irritable. Once somebody has been noted with those signs and symptoms, it is important for that person to be seen by the doctor. How tonsillitis is diagnosed. Doctor will do physical examination. On physical examination, he will look at the tonsils, whether the tonsils are swollen or whether the tonsils has got pus. Doctor will check the nose and will also check the ears. He may also check the neck for the swelling at the side due to swelling of the tonsils. Another test that will be done, it will be throat swab. Throat swab will be taken and it will be tested. That will also help to show or to find out what is the cause of that tonsillitis. It's either caused by virus or is either caused by bacteria. Blood work will also be done. All these tests are done to confirm the diagnosis or to find out what is the cause of tonsillitis. Is it bacteria or is it virus? This is important because the treatment is not the same. How the tonsillitis is treated. Tonsillitis is treated according to the cause of tonsillitis. In viral tonsillitis or viral infection, the antibiotics are not given, but somebody will be encouraged to take something for pain just to relieve the sore throat, will be encouraged to take enough rest. A person will be encouraged to gargle with water and salt so as to relieve the pain on the throat. Tonsillitis, in this case, it may be the cause, maybe somebody was having cold or flu. In bacterial infection, it is important for that person to be given antibiotics. And it is also important for that individual to be encouraged to take the full course of antibiotic so that the infection is treated correctly, because if it's not treated properly, the infection can also come back, or it may even lead to another complications. Maybe the abscess can develop there, which is another complication. In some cases where the patient is having chronic and recurrent tonsillitis, the doctor will actually advise or educate that it is advisable to have surgery, and that surgery there will be removing the tonsils, and the operation is called tonsillectomy. In case where the patient has to go for tonsillectomy, that patient will be admitted in the hospital. Patient will be prepared because the patient will be taken into theater for tonsillectomy. Tonsillectomy can be a day surgery. The patient will be educated prior to surgery or will be educated in the clinic. The patient will be informed what to do. A patient will be informed about the fasting. The patient will be informed what time must be in the hospital, especially if it's going to be a day surgery. It can come very early in the hospital and it can be admitted, and then it can go for surgery. But in some patients that are having some other medical condition, it is always advisable to admit the patient the day before so that the patient will be prepared for surgery in the hospital. Once the patient is in the hospital, will be taken into operating room where the procedure tonsillectomy will be performed. It is also important to educate the patient about the post-care after the procedure, because the patient may be discharged by the end of the day. Therefore, it is important to know what is supposed to do after the operation, how is he going to prevent infection that can occur if the proper post-op care procedure is not followed. Otherwise, if everything goes well, tonsillectomy can be a simple operation and the patient will be admitted and will be discharged by the end of the day with medication, and that medication that will be prescribed post-surgery is also important to educate the patient to follow medication as prescribed. For today, we will end up here. If you do like these short videos, please share, please subscribe and comment so that we will know next time what we can talk about. Thank you for love and support. Till next time. Stay safe and stay healthy.